Here are a group of cases of horseshoe lung. Note on this frontal view of the chest that the right lung appears hypoplastic. We see some abnormal vessels close to the left side of the diaphragm. In the lateral view of the chest, we see a prominent left hilus. Although we may think that the oval density ventral to the trach is the right pulmonary artery, is due to a left hilus, not the right pulmonary artery. A bronchogram showed a normal left bronchial tree. However, the right bronchus shows that a branch of the right lower lobe bronchus curves and is directed medially. This should make one suspect the presence of a horseshoe. In this lateral bronchogram, we can see that the bronchus to the right lower lobe is well demonstrated, and we do not see the filling of the right lower lobe bronchus close to the right dome of the. A pulmonary angiogram showed a dextral position of the heart, and we do not see adequate filling of the right pulmonary arteries. In a late phase of the pulmonary angiogram, we note that the right lower pulmonary arteries are directed immediately towards the spine. This is a virtually pathognomonic sign of a horseshoe lung. We note in this late phase of an angiographic examination the presence of pulmonary veins. Some of these veins drain in the left atrium, some may drain into the right atrium. In this other image of an angiogram, we note that the left atrium receives the left pulmonary vein, but there is a pulmonary vein that comes from the horseshoe segment that drains into a left lower pulmonary. Here is another angiogram which reveals the left atrium receiving left pulmonary veins, and we can see the venous face of the segment joining the two lungs, and these veins can drain into right or left pulmonary veins, or even may drain into systemic veins. This is another case that shows what appears to be a dextral position of the heart, a hypoplastic right lung, and a vascular channel that is directed from the right base towards the midline. At first glance, we might consider the scimitar syndrome or the venolobar syndrome. However, note that there is some distortion of the vessels of the left lower lobe. The lateral view of the chest confirms the presence of a hypoplastic right pulmonary arterial tree. We do not see the normal oval density that normally projects ventral to the trachea, representing the right pulmonary artery seen on end. A faint visualization of the airway shows that there are branches of the right lower lobe bronchus supplying a segment of lung interposed between the two lungs. So this is another example of a horseshoe lung. Another case of a horseshoe lung, note the dextral position of the heart, dextral rotation of the heart, which produces a straight left heart border and a prominent right atrial border. This is because the heart rotates using the caval axis as the hinge of a door. When the heart rotates towards the right side, the left heart border appears somewhat straight, and we see a prominent convexity that represents a normal right atrium. The right lung is hypoplastic and shows hypovascularity. The left lung is increased in volume and shows slight increased vascularity. A bronchogram shows that the right main bronchus is vertically directed, and we see some bronchial branches that are directed towards the midline. A pulmonary angiogram revealed the hypoplastic right pulmonary artery, and branches that supply the tandem portion of the horseshoe. This is the levoangiocardiograph of the same patient where one can see veins that are directed medially, and some drain into the portal system or can drain in the inferior. Another example of a horseshoe lung, this could be a case of a hypoplastic right lung syndrome. Note a diffuse haziness of the right hemithorax and hyperlucency of the left. Note that we see indistinctly the right heart border. In the lateral view of the chest, we see evidence of what appears to be a hypoplastic right lung. At first glance, we may think in atelectasis of the right middle lobe or right upper lobe because of the haziness that is seen in the ventral aspect of the right lung. The same patient in a penetrated view shows that there are markings that are directed medially, and note the evidence of haziness in the lower half of the right lung. This haziness can be either fibroadipose tissue or may represent a hypoplastic or a collapsed right middle lobe and right lower lobe. In this other view, we can see markings that are directed towards the midline and towards the angle between the diaphragm and the heart. This case may have been considered an example of a hypogenetic or hypoplastic right lung syndrome, the so-called venolobar syndrome or the so-called scimitar syndrome. It was another example of a horseshoe lung. Finally, we have another example of a horseshoe lung where the right heart border is indistinct. We see diffuse haziness. We see markings that are directed to the right cardiodiaphragmatic angle. These markings may represent abnormally draining veins or systemic arteries supplying the right lower lobe. It is not possible to tell one from the other on the basis of the plain radiograph. A pulmonary angiogram shows the pathognomonic sign, which is pulmonary artery branches that are directed medially. A later phase of the pulmonary angiogram shows some opacification of the tandem, the bridge between the two lungs, a pathognomonic sign of the horseshoe lung. In the venous phase, we see normally draining left pulmonary veins that fill a left atrium. We also see that veins from the right lung are directed medially. Some of the veins of the right lung drain towards the inferior vena cava. So eventually we may see reopacification of the right atrium due to anomalous pulmonary venous return from the horseshoe lung to the right side. This is a specimen of a horseshoe lung. There are portions of lung that are noted close to the inferior aspect of the heart, actually behind the heart. Upon opening the pericardium, we may see portions of the lung, some of which are extra pericardial. Rarely we may see a type of sequestration that is within the pericardium.